What if I told you that inflammatory bowel disease is curable? Well, hello, I'm Dr. Krystosik, and today we're going to talk about a serious common illness, inflammatory bowel disease, also known as IBD, like Crohn's disease or ulcerative colitis. By the way, which affect the digestive tract and cause chronic inflammation, pain, and a whole bunch of other symptoms. Inflammatory gut disease happens when your immune system gets confused and it attacks your own body, attacks your digestive tract, leading to inflammation and ulceration to the gut lining. Now, genetics play a small role, but the big causes are environmental factors like the gut microbiome. That's the imbalance of bacteria inside your gut, and the immune system dysfunction, or the immune system gets confused. Now, common triggers are hidden food allergies, refined carbohydrates and sugars, and junk foods, especially. Stress and smoking and infection can also worsen the symptoms. Symptoms of IBD can vary depending on the location and the severity of the inflammation. Common signs include abdominal pain and chronic diarrhea, blood in the stool, fatigue, weight loss, and bloating. Now, some people also experience joint pain and skin rashes or even inflammation in the eyes. IBD can affect the whole body, not just the gut. So, how do you know your gut inflammation is mild, moderate, or severe? Often, mild symptoms include occasional discomfort and bloating or changes in bowel habits. Moderate or severe IBD may involve chronic diarrhea, and you'll find blood in the stool or severe abdominal cramps, fever, or even weight loss. Now, if you experience the severe symptoms, it's extremely important to seek the attention of a drugless functional medicine physician without delay, because untreated IBD can lead to serious complications. Now, let's talk about how to manage inflammatory bowel disease naturally and support healing along with natural medicine under the guidance of a qualified functional medicine doctor. First, diet plays a major role. While every person's triggers can differ, many patients benefit from eating anti-inflammatory foods like gluten-free grains and getting off of dairy foods and some other foods that can cause allergic reactions, and eating whole grains that are not in gluten, like millet and quinoa and brown rice. And of course, eating fatty fish like wild caught salmon and using olive oil and flaxseed oil. You know, the oils that you use are very important, and don't use seed oils that are not expelled or expressed. Identify hidden food allergy with a specific blood test. Avoid processed foods like refined sugar and refined carbohydrates. And make sure you stay away from alcohol if you have IBD, which can worsen the inflammation. Next, support your gut microbiome, the beneficial bacteria in your gut. Well, that's really important. And probiotics like Saccharomyces boulardii, and eating fermented foods like sauerkraut and kimchi and kefir and kombucha. That's going to help to restore the balance of the bacteria in your gut. Now, as I said, reducing inflammation and improving digestion is going to be done by lifestyle habits that are very important to make sure you change those. Chronic stress is one, and that can flare up IBD symptoms. So you want to make sure that you're including prayer and meditation and deep breathing in your daily lifestyle. All along with gentle exercise. These are all important. And make sure you get 7 to 8 hours of sleep every day. That's really a key element, because your body repairs the gut and restores the gut and helps to reduce inflammation during rest. Specific supplements can help to support the gut healing, like aloe vera gel and slippery elm bark powder. They help to repair the intestinal lining. Zinc carnosine, there's a lot of research that shows reduces inflammation and also repairs the gut lining. Omega-3 fats from fatty fish help to decrease inflammation and calm down the immune system. Of course, always consult with a natural doctor before starting any supplements. The good news is that combining diet and lifestyle medicine under the supervision of a really experienced natural healthcare physician can reduce flare-ups and even cure IBD. Yeah, I did say cure it.
I had ulcerative colitis. The doctors said that they were so bad that they wanted to cut out my colon, and they told me I would have to be on the medication for the rest of my life. I came to you. I stayed on your program. You stopped the diarrhea, you stopped the bleeding, and it's just amazing. It's just amazing with what you've helped me to do, and the swelling has gone really gone. And as of like 3 months ago, I went off all medication. And my doctor was shocked because I had been so well since I had seen you, and I thought I was bedridden I was bedridden for a month, and I thought, geez, this is it. I wasn't get to go anywhere, and last year I got to go to London by myself. It's really a miracle.
Now, let's talk about prevention and long-term management. You can't change genetics, but research shows that genetics only contributes to about 10% to the condition of IBD. 90% is up to your diet and lifestyle habits. And you have the power to influence your environment and lifestyle, my friend. Maintaining a balanced diet, like eating anti-inflammatory foods, as I mentioned, avoid smoking, managing stress, staying active, and prioritizing gut health are all important strategies that help to reduce flare-ups and to cure your inflammatory bowel disease. Regular checkups with a natural healthcare provider, including getting blood tests and colonoscopy when indicated, can also help catch inflammation early before complications set in. Remember, inflammatory gut disease is serious, but the good news is that it is curable. Early recognition with proper diet, gut support, stress management, and close natural medical care supervision can make a dramatic difference in your quality of your life and help to reduce the symptoms and even be able to restore your health without drugs or surgery. You know, many of my patients were told they had to be on medications for the rest of their life with IBD, or they required surgery to move parts of their small intestine or their entire large intestine. And under my care and the supervision that I gave them with my diet and lifestyle prescription, well, they got off their medications, canceled their surgeries, and they're living symptom-free, many of them for decades and decades. And even to this day, I get calls from people thanking me for helping them. Now, if you found this video helpful, I encourage you to like it and share it with somebody who's struggling with inflammatory bowel disease. And I encourage you to subscribe to my channel for doctor-led advice on gut health, digestion, and natural healing strategies. Your gut health matters, and with the right approach, you can manage inflammation, reduce flare-ups, and in fact, cure your inflammatory bowel disease. Until next time, ciao for now.